see. Aha. Hey, everybody. Happy Monday. Thank you guys for joining us here today. I am so excited to have these moments with my dear friend and colleague, Dr. Jane Brewer. Dr. Jane we've known each other for what, 10 years?
I don't know, many years, probably.
Many years. Yeah, we've been hanging out in the lovely, a decade. A decade. We've been hanging out in the Loveland, Colorado area, and I've been so blessed by friendship and the ability to be in the realm of the chiropractic profession with Dr. Jane. Can you tell us a little bit more about yourself, please?
Thanks for having me on. This is a fun way to spend my lunch break. I have been in practice for 10 years this year, which is crazy. I went to Life University in Atlanta, graduated in 2014. And I was living in Colorado for many years before chiro school and couldn't imagine living anywhere else. So we promptly moved back here and I opened Precision Chiropractic. So we're an Upper Cervical Chiropractic clinic. So I'm kind of a head and neck specialist. We really focus on that area where the head sits over top of the spine. It's a very delicate area that requires a very careful and dedicated approach. And that's really what we focus on here. And so we care for a lot of folks that are dealing with things like headaches, migraines, vertigo, post-concussion, whiplash injury. And, of course, we take care of more general chiropractic cases, but that's really where we shine, I think.
Now, I just want to emphasize to everyone how special of a technique you use, how special of an imaging. Talk about your imaging for me. Sure. I got so turned on to the imaging that Dr. Jane's going to tell you about here in just a minute. Honestly, it was initially ignited in me at a holistic dental office who is doing things more in a orthodontic, natural, what am I trying to say? Palate widening. And so I was
totally like for airway issues, that type of thing.
Yeah. Airway issues. And so just the correlation between that for me, Dr. Jane, and what you do was like, whoa, tell me more about what Dr. Jane does. So tell us about your imaging and what you use.
So I would say it was January of 2023. So gosh, almost 2 years at this point, we invested in what's called CBCT, or cone beam computed tomography. I can't spit that out. And CBCT has been used in a dental setting for a very long time. And we, as upper cervical practitioners, have adapted that technology to really analyze in 3 dimensions the head and the neck. And it's really incredible, the image quality that we get, the detail that we get, and that just levels up my ability to analyze for certain things, especially those misalignments at the head and the neck, to be even more precise with my care. And, x-rays are incredible. And for, that's the foundation of where our profession has come from. Seeing, in my opinion, is knowing. And especially when it comes to an area that's so rich in neurology, muscles, ligaments, and has a huge bearing on the functioning of the rest of the body, to be able to see it, measure it, and correct it as specifically as possible is really paramount. And so investing in CBCT was kind of the next logical step. I was like, I want that. And so, we installed that a couple of years ago, and it's really leveled up our ability to see what's going on and really just care for people in an even better way.
It's so awesome. Amazing. I mean, and before I had my scan done in your office, was it 6 months or so prior to that I had it done at the dental office? And of course, I know they're looking at their things, right? But I am a chiropractor, and they throw my image up on the screen, and what do I look right at?
Yep.
C1, C2. You know what I mean? Like, I'm looking
absolutely
at C1, C2, and I'm just going, oh, like how incredible. Just incredible imaging. And again, like I said, I correlate back to, okay, so they're looking at the way everything from a developmental standpoint was going on for myself, for airway and all of that. And obviously how my work with them correlated with what you could do for me chiropractically, because of all the very intricate, very specific needs you found that I needed.
Totally. We actually co-manage with several airway-focused dentists in, Denver, Northern Colorado, because they recognize that it's connected. And, we don't typically think of the top teeth as movable, right? We move our bottom teeth every time we open and close our mouth. But the way our top teeth move is by moving our neck And if the
Yes.
neck isn't moving,
Yes.
going back to the topic of our conversation today, if the neck is stiff and sore and crunchy, then chances are, if you're clenching, grinding, if you have TMJ issues, if you wear an Oura ring or any other device that monitors your like O2 saturation through the night, or even your sleep quality, if it's diminished, you may not have full on sleep apnea, but you may have subclinical sleep apnea issues where your body's just not oxygenating as well as it should be.
Right.
And the way I look at it from a, upper cervical chiropractic perspective is there a structural component to that? And is there misalignment at the upper neck that's creating a choke point? And, all the things that we can see on that incredible imaging, of course, are the structural components, but then we also have to know what vascular structures live there, what neurological tissues live there, and how that all plays into it as well.
So cool. So cool. And so, like you said, our topic here today was stiff, sore, and crunchy. The reason we pick something like that is because that is what so many people find both myself and Dr. Jane for is, they're noticing pain. I mean, I don't want to speak for you, but that is usually the person who ends up in my clinic is they're noticing pain, they're noticing discomfort. And so stiff, sore, and crunchy, I mean, where in your wheelhouse, what do you see from a musculoskeletal standpoint? I'd love to say my top 2 or 3 things that I see from an inflammatory toxic standpoint after you talk about everything musculoskeletal.
For sure. So because we invested in advanced imaging a couple of years ago, I read all my own images, but we also do send all of our imaging out for an independent radiology read. 2 heads are better than one, especially when it comes to complex things. And some of the biggest things I've noticed are, of course, degenerative changes that can happen in the spine as joints lose cartilage and as those discs wear thin. You're going to have some range of motion issues. You're going to have pain, discomfort. Things are just not going to move as well as they should. So they're not going to feel as well as they should. So that by and large is probably the number one thing. And I agree, a lot of people seek us out because they are not feeling as well as they should be. And some of those degenerative changes are the number one thing that I see. What else? We also,
so when you see them experiencing that pain, what do you see them experiencing from how it is, right? Pain is only one signal, you guys. It's the one signal. It's actually the littlest signal in your body. All these other signals would have gotten their attention if they could have, but they didn't. So the pain gets our attention, right? And so what other signals do you see as the specialist? They come in telling you it hurts, it hurts, it hurts.
Sure.
But then, and you do your eval. And so again, you talked about degeneration of the joints. What else? What else do you see?
We use some awesome technology in the office called neck care. And that tests what we call joint proprioception. Basically, we're testing how well do those joints in the neck talk to the brain about how your head is positioned in space. When your body doesn't understand where your head is positioned in space, what that can manifest for some people as is unsteadiness, dizziness, vertigo. We take care of a lot of folks who have almost just brain fog. They just don't feel as clear-headed as they should. Sometimes that can have, at least in part, roots in a structural shift, a misalignment at the top of the neck, because it can act as a choke point. Really, ultimately, the goal is to just make sure your brain and body are communicating with each other as optimally as they should. And, it's funny, not everybody thinks, oh, that's the job of a chiropractor, but it's 100% the job of a chiropractor to ensure that, what I like to think of as our body's electrical wiring system is firing on all cylinders, because that's how anything in the body happens.
Oh, yeah. Oh, yeah. And I just, sometimes I feel like people have come to us as chiropractors and they get what they want, but then they also get what they need over, I have a clearer brain and I didn't even know I had brain fog. I'm sure you hear that, where they told you X, Y, and Z symptom and they get under your care. You find what you do your thing, you find what they really need. Yeah. And the discomfort they came for, that is a pleasant side effect of better movement and better neurological flow. But then they will talk about improved symptoms and things that they maybe didn't even think they weren't aware of until you got rid of it. until
That happens
your
all the
care.
time. Yeah.
Yeah,
Well,
until
then,
your
I
care
think,
needs it.
yes. And the way I see myself as a facilitator, right? I think any of us, all we can do for anybody is introduce the right conditions in the body and allow that person's system to heal itself. That's how it all happens, right? We just introduce or be a part of introducing the right conditions for it to be able to do that.
Exactly. Now, if I could, on that note, from a chiropractic standpoint, with um, pinpointing specific toxins and detoxing those, absolutely 100% in a similar ballpark of a facilitator. This detox protocol is going to facilitate the toxin that is causing the inflammation to start moving, so that again the tissues can absolutely function as necessary and needed. I was working with someone the other day, Dr. Jane, who they're with me from a detox and nourishment standpoint. We found heavy metals, we found parasites, and I'm working with them virtually, but they're not seeing a chiropractor. And they're states away, and we Dr. Jane and I, we roll in big circles, and so we're like, I can find a chiropractor, at least someone
Absolutely.
close to you, right? Like that's what we try to do. We try to find, if someone is in another area of the country, and we finally got her connected with a great doc, and she didn't start seeing all the results that I knew were possible for her under my care for detox and nourishment until she started chiropractic care.
That's really cool.
I'm like, you got to have the nervous system turned on. Your supplements and even our food changes are not going to handle this subluxation that I'm telling you it's there. I just got to have a chiropractor give you the professional evaluation. And so on my end of things, I just think it's so cool when if someone comes to me, they're not doing a whole lot of work on their body. They have a lot of work they need to be doing. And great, they get started with me. But then when they start with the chiropractor, it just like their
Magnifies it.
Oh, yes. Yeah. So
That's really cool. And I am such a firm believer in collaborative care. I really do think it takes a village. I don't know that any of us have the one right answer for any certain picture clinically for somebody.
Right.
And I mean, that's why I so appreciate having you locally, but we just have such an incredible community of healthcare providers up in Northern Colorado that, kind of like you said, you see a lot of patients out of state because of your virtual practice, which is amazing. So we just quarterback it, right? We try to find people who we can put our faith and our trust in to be a complementary part of somebody's care.
Yes. So it's so true, because again, there are different facets and, different facets to mind, body, and soul healing. And in today's world, there's just so much coming at people. So much. I mean, the level of stress, uncertainty in our world, uncertainty in our healthcare system. Oh, I did this, or this, and I don't know that it helped me. It might have made me worse. I mean, I know you hear that all day, every day too. And so to collaborate with practitioners and doctors who are, at the end of the day, we are trying to remove what shouldn't be there, right? Like if we remove the problem that is blocking the person's flow and healing, then their body can do the rest. And that is absolutely the chiropractic philosophy.
And then teach them how to keep it that way for as long as possible.
Correct. So what tips do you have? What do you give to your chiropractic patients after, they're in the middle of your care plan, and what do you have them doing in between their appointments?
Yeah, I think something that's unique about Upper Cervical Care is that we actually rest our patients after an atlas adjustment. And I think that goes a long way. I mean, that practice goes back many, many, many decades. And the upper neck is really unique. It's stabilized by a lot of soft tissues, so primarily ligaments, and we have some muscles in there as well, of course. But patients will go rest for at least 15 minutes after an upper cervical adjustment, because I think it goes a long way. Instead of just hopping right back in your car into the rat race and like backing out of your spot and just kind of undoing everything, it not only helps from a structural standpoint, but even from a neurological standpoint. We often, and I include myself in this, Dr. Lauren, like we do not give ourselves time to rest. No. And it's such a treat for 15 minutes to just let your system settle down, get back into that parasympathetic rest digest sort of state, because we're just go, go, go all the time. And I think there's something to be said for that balance. So I think that's something unique that many upper cervical practitioners incorporate into their day-to-day.
I really do feel like you all with the upper cervical technique are those you have dedicated space in your clinics for that practice,
Yeah, makes for a good nap at lunchtime sometimes too.
Absolutely. Kick right back. I mean, and it makes so much sense. Like you said, we get this perfect alignment. We are, we handled the subluxation, and then we go out into traffic and someone starts yelling at us.
And that's life, right? Like we can't avoid encountering stuff like that.
Right.
But, I think even like, back in the day, BJ Palmer referred to it as constructive survival value. The way I think about it is like the better foundation we can build, the better intake we have as far as food, the better sleep quality we have, the better alignment we have. Like all these things are like depositing money into your savings account. And when things happen in your life, like, the fender bender, or you just had to move out of your house, or you're just going through a stressful period of time, you're going to start drawing on that savings, but it's okay because you're not going to overdraft it. Like you have that banked up, and you build your ability to adapt, which is everything. And you just build your resilience over time by making the next right choice over and over again.
So good. I love how you use the word deposits. I don't use that word. I use investments, but I'm totally going to use the word deposits now. Like, I love that because I hate even hearing, your health expenses. Well, yeah, there are plenty of things that we see people as an expense of health stuff that really didn't take them to the next notch of getting healthier. Totally, completely agree, where it's like, that gets expensive when it doesn't really get them where they want to go. But when someone is on the daily, weekly, monthly basis, investing in high quality food, investing in time for rest and for sleep, investing in their body care with coming to your office, investing in supplementation to be removing toxins,
proper movement, all the things. Like,
it's not all money investments, it's time, money, and energy. And I hate to break it to people, but that is what it takes to be healthy in today's world. And anyway, it's a value system, and we all have our values on different things.
Yes.
And it's just so exciting to see people when it really clicks for them. I'm sure you see it too, where they almost have the ability to give themselves permission to have higher value on the time, money, and energy that they spend on their healing.
For sure. Yeah, it's really, I think that's probably one of the most rewarding things about what we do.
Yes.
And it's the empowerment piece. Like, of course, people are coming to us for solutions, but I think the real magic happens when folks realize that they have the ability to do most of these things for themselves. And that their bodies are supremely intelligent, and we just need to furnish the right conditions for them to be able to function as well as they should.
Empower them. People who are healthier, we're more rational, we're more in control, we make decisions not out of fear. Like, that is when you are healthier. Again, the deposit you put in and you're investing, you're also investing. Again, I mean, it's a policy, it's an investment, it's an insurance policy of sorts. And so with that being said, I also love, for you, I want people to know about you, all the ways that you invest in your community, all the ways that you invest in your practice and your practice members, and your team and yourself, because I see you going to training all the time. Remind me to remind everyone else give us more information about what you are a part of, even in the chiropractic profession.
For sure. And so I graduated with, it's called the DCCJP. So it's a Diplomate in Chiropractic Craniocervical Junction Procedures. I know that's a lot to say, but that credential, there's I would say about 60 of us with that credential worldwide. There's not that many of us. There's another cohort going through the process now, which is really exciting. But that credential really, and that program, which was about 2.5, 3 years, is really what lends itself to having the specialty that we do here. So I actually currently serve as a board member for the International Chiropractic Association's Upper Cervical Council. And I'm also on the board of directors for orthospinology. So orthospinology is one of the upper cervical techniques. It's the one that I practice day to day. There are many upper cervical techniques, Blair, Nuka, knee chest. There's a whole bunch of named upper cervical techniques. The one I do is orthospinology, and I just recently joined the board there. And then locally, I have served on the board of Loveland Habitat for Humanity. I just adore that organization, and I've been involved with Habitat for, oh God, almost 25 years. Mm-hmm. And I mean, for those of you who aren't in Northern Colorado, I'm sure affordable homeownership is problems are everywhere, and Habitat really is doing a lot to overcome some of those issues and put people who are huge contributors to our community into affordable homeownership situations.
So good. Thank you for explaining all that. I knew it wasn't, they were tongue twisters, and I was going to.
It's a lot.
So I'm glad you could explain that. Also, you guys, Dr. Jane you're going to be MC on a big stage this fall, right?
Yes. And so Mile High, which is a big chiropractic event put on by Dr. Stanny and Rochelle Knowles. Yes. Mile High is coming up September 26th through the 29th. And it's a really fun event. Like after I graduated from school, I sort of crawled in a hole, and I really focused on building a practice. Mm-hmm. And now that I've got my feet underneath me a little bit, I've been trying to get out more and support people and organizations in our profession who are doing amazing things. And so, yes, I was asked to be a co-MC for this year's Mile High. So that'll be super fun.
So fun.
And only mildly terrifying. That's okay.
Got to do stuff that scares us. You got
That's right.
So it's gotta
That's
be
how you grow.
It makes us grow. No, I am just so excited. I wanted to make sure we, like you said, we have viewers from all over the country, mm-hmm. but we have lots of local viewers. And so for sure, wanting to let them know how they can find you and get in touch with you.
Oh, sure.
So even if you could rattle off your office phone number and your office website, please.
Okay.
Like, how can people get in touch with you guys?
So my practice is Precision Chiropractic. We're currently located in Johnstown, the Loveland part of Johnstown, for those of you who are local, right by Shields, the big sporting goods store. Our office phone number, 970-663-1617. And our website is precisionchiroco.com.
And we'll for those that down below too, okay?
Okay, yeah. Awesome. And for those of you who are not local, Upper Cervical Chiropractic is such an amazing subspecialty of the chiropractic profession. So, if you're experiencing, any of the things that I mentioned before, specifically things like headaches, migraines, if you're post-concussion and just not feeling your best, any autonomic issue, gosh, POTS is such a big issue now coming out of the recent years. So if you're dealing with something like that and you want any assistance finding an upper cervical practitioner in your area, you could just email me, and my email is just my name, jane@precisionchiroco.com. So feel free to reach out. I'm happy to help you find a provider in your area.
You have, you know who is where, don't you?
Yeah. There's not that many of us. If we don't know each other personally, we certainly know of each other. So
right. Yeah, for sure.
Easy to find. And it may require a little bit of a drive. Like I drive an hour for my own upper cervical care. And it's worth it. It's 100% worth it for me.
Mm-hmm. And you guys, I've been under chiropractic care since I was like 10. Mm-hmm. So I'm 42. And it's been so exciting and such an honor to be the patient of Dr. Jane as I embarked on a new, I'm calling it holistic plastic surgery, because they're going to make my skinny little palate nice and a nice big, instead of, I was supposed to be chunky cheek Swedish girl, and I had all these issues. And so a combination of that and a different look and a different approach chiropractically with what you found and what this is what I will say. Cause again, I'm an original gangster of chiropractic. I've been in chiropractic for decades. And what I noticed differently after being under your care for several months is I can't totally explain it, but I know, with just the way that your specific adjustment is helping my C1, C2 junction, I'm symmetrical. I'm not clunky over here. And, I'm just like, that's what I notice. And also the way that my jaw opens and airway, like you were saying, not less about, but for me specifically, it's about my neurological functions. And it's just been incredible eye-opening. So even if you guys are looking for Dr. Jane and or someone like what Dr. Jane does in your area, after this is over, we'll put more information so people can reach out to you after this. But
for sure. And there are online a lot of upper cervical directories that you can find. Like you can, just search for upper cervical chiropractor near me. But if you do want more of a personal referral, please feel free to reach out. And I know for myself, like all of our new patients start out with a complimentary consultation. Like I just want to have that conversation with somebody and make sure that it's a two-way street, that somebody's in the right place to receive help and that I feel like I can help them.
Yeah. Yeah. By the way, you guys, one of my favorite people on the planet besides Dr. Jane, she is in the upper cervical realm. She's north here. She's in the North Dakota area, right? Like, so, when in the chiropractic, I love how in the profession, we want to send people to people we know, like, and trust, even people who we know they'll resonate with the personality of the doc. And that the technique is what they need. There are so many different techniques in chiropractic, and there's definitely specific, there are reasons why you would seek out upper cervical specifically. Mm-hmm. So absolutely. So Dr. Jane, we're just so thankful that you spent your lunch break with us.
Thanks for having me. This was really fun way to spend lunch.
Likewise. And please check out the info that we have of Dr. Jane and her beautiful clinic in beautiful Loveland, Colorado. And we would love to have you another day on another topic that we could roll through at another time. Okay.
I would love to. I love hanging out.
Likewise. Hey, you have a wonderful day, everyone who watched this live. Thank you. If you didn't watch it live and you are watching the replay, you have any questions that you want us to answer, you can still put them in the comments, even if you weren't here with us live. So thanks, you guys. Thanks, Dr. Jane.
We'll see ya.
Bye.